So this afternoon, I want to talk about advocating for your child at school. I've enjoyed the presentations leading up to this one, and I really appreciate a lot of the points that were made really about advocating for your child in general. This part will focus on the school setting. And just to get us started, I thought it would be nice to see if we could poll the audience, if possible, with a couple of questions. So I know that we have someone that might be working on that, and we can actually poll throughout. I don't think we have to look at those results right this moment. But there are a couple of questions to help me understand the audience and what your experiences have been with regard to advocating for services. But for today, our objectives will really focus on thinking about what educational needs your child might have, and I'll say, or you might have if I'm speaking to anyone who is a student and is managing themselves in an educational environment. Also, to understand the law, we have to start with a legal context when we discuss educational services, since that is where everything begins, and that then informs a student's rights. And so it's really critical that we're aware of what those things are. And then understanding the process for accessing support services. And those two things, understanding the law and the process, are going to kind of go together. So I'll talk about those at the same time. And then finally, want to cover how to identify resources to support you all throughout the process. So I'll say some things that might be very obvious to this audience. We know that AFM is a complex medical problem, and the symptoms that are associated with AFM have the potential to interfere with aspects of our educational participation and learning. So it's really important that we work to assess those needs, and that helps us determine what services are appropriate for that learning environment. I like to mention this right up front. There's no one-size-fits-all approach to educating students with AFM. There's just not, and we don't have research on this, but I suspect if we did, we would have lots of different findings, because we know that outcomes associated with AFM vary so vastly. So just like we think about in psychology and neuropsychology, which is my field, and even in the schools, services really have to be tailored to each child. I think that's a really critical point. I'm going to pull some information from a school guide that our school liaison, Linda McCowan, put together at our clinic in Dallas at Children's Health. So I'm going to make sure that these resources are available. I'll talk about that school guide at the end and how you might all use that to start a conversation with your schools. So thinking about how schools can assist a student with AFM, the very first bullet point here in this guide is about academic services that are under these laws, which we're going to really dive into, our special education law, or IDEA, as well as Section 504. Some other tips that were incorporated into this guide have to do with adjusting schedules. We know that our students, our patients, have a lot of appointments they have to go to, our therapies, doctor's visits. So, creating a strategy around that schedule to minimize the school that is missed. So that is one idea. There are a number of accommodations that may be relevant or appropriate and helpful if hands are affected, and that could be things from extra time to getting some assistance with notes and getting copies of notes, doing oral testing, other things related to accessing PT and OT at school. I'll talk about that a little bit, or thinking about adaptive PE. We'll get into more examples as we talk today. We do want to acknowledge, and I think this falls in line with the previous conversation, our social and emotional well-being. In our clinic, we do have psychologists, neuropsychologists involved, because we want to treat the whole person and understand how a medical problem could impact someone in these social and emotional domains. So thinking about what type of support in the school environment might be helpful, even if it's just some ongoing monitoring, making sure staff are aware of the situation, checking in with the student, all the way to formal and more formal counseling services that would be available at school. And I just always recommend frequent communication with parents, the school personnel throughout the year, but even more frequent if we're transitioning back to school after AFM or we're getting acclimated in a new school year. Some other physical symptom considerations might be to have an extra set of books, so we're not taking books to and from school, having lockers in different locations around the school, especially if things are spread out, either across campus or on different floors. You know, a lot of times at schools there may be elevators, but you know, they don't give students that access. But if we have you know, a plan in place, we can give an elevator pass for that, as schools can. Other things, accommodating students in different school or extracurricular activities, a field trip. We talked about adaptive PE already. We might want to have a change of clothes at the school, have a nurse pass, a bathroom pass, extra time to go between classes. Again, I will share this guide with you, but these were some of the things that were generated by our team when we put this together. And again, knowing not all of this will be relevant for every person with AFM, but it does help, I think, with thinking through what might help and brainstorming what the possibilities might look like. Switching over to this legal context, thinking about students' rights, as well as processes for accessing services. You know, I created this slide. I find myself trying to verbalize this a lot when I'm talking to parents and families or giving presentations. The really good news is we've got access or programming, I should say, to services from birth, really up to age 21, 22, and then as we transition over into college employment settings. So there are a lot of things in place to protect our individuals with disabilities to make sure that they have the support that they need. And so I'm going to talk about several of these. I won't spend so much time on the early years, but I did want to make people aware of this so that you know that that type of programming is out there. And then there are pre-K services as you move over into kind of that pre-K through 12 environment through the school district. Mostly we'll focus on our special education in 504, and I will end talking a bit about transition to college since that's such an important piece of the puzzle for our kids as they grow up. So first, just touching on IDEA. So if you hear, if you're talking about special education, you're talking about the Individuals with Disabilities Education Act, IDEA for short. And this is all about that our children are entitled to a free, appropriate public education. You'll see a lot of acronyms. It's almost like learning a new language when you delve into this world. The point of this is to prepare our students for further education, employment, and independent living. And it's so important to point this out. The burden is on the school system to identify our kids with special needs, evaluate them, and create these educational plans that are directly informed by that evaluation process. And so the school is really meant to be responsible for this, but I will say parents and providers like me are also able to initiate a process to put these services into place. Our special education categories I wanted to briefly show here. I want to make a few comments. Most of the time, our patients with AFM or other demyelinating disorders are falling under this other health impairment category. So if you ever see that or hear people saying OHI, that's what they're talking about. It is possible that a given student would be eligible under multiple categories. So we, when we work with our kids with demyelinating disorders, we are always thinking about ruling in or out learning disabilities, ADHD, all these other things that could be going on. So wanted to highlight this slide and OHI in particular, even though other categories may be relevant depending on the child. If you are hearing the term IEP or Individualized Education Program, this is, you're talking about special education still. And this is that written plan that comes out of that process I talked about where they do an evaluation and determine what those specific needs are. This becomes an agreement, a written agreement between the school and the parents on how the student will be educated. This plan has to have measurable annual goals. It is tracked very closely and very carefully, and it is reviewed and revised at least every year. So it's really important that parents know what's in this plan and are monitoring these goals very, very closely right along with the school. So in terms of getting started, if say, you don't have any services, but you suspect that your child will need them, step one is the referral. Okay, so that can be done by a parent, a teacher, another professional. We do say the school is responsible for identifying a student with a disability, but again, a parent is able to initiate this process. The school will gather information. They'll decide if they need to do an evaluation, which I'll talk about next. If they are going to deny an evaluation, they do notify you in writing, and then parents do have the right to appeal or follow up on that. Typically, in my experience, though, I see that a school will either take an evaluation we've done at Children's, or they will conduct their own FIE, there's another acronym, full and individual evaluation, again, part of the special education process. This is at no cost to parents, and this evaluation is meant to simply answer the questions of, does the student have a disability under that special education or IDEA definition that I showed you? And then is there a need for special education based on that disability? It's really important to mention this, that our students we want them in the least restrictive environment for their services. So I have worked with patients and students that get services across this whole spectrum, from the general education room, so they may be getting special education, but are mostly getting general education and some extra support, all the way through to a self-contained environment. We just want to be mindful of and make sure that our students are in that least restrictive environment and have the most opportunity to be amongst their non-disabled peers. And for some students, that may include participating in art lunchtime with non-disabled peers, or it could be more extensive and throughout the day, more in that general education environment. Related services, which I think are really important to talk about when we think about AFM, would be our therapies. So if speech, OT, PT are needed in the school setting, maybe other psych services, assistive technology, there's a range of these related services. The key here, and I've had this conversation with schools multiple times, the key is that it's educationally relevant. So I have been in the position as a clinician speaking to a school to say, we really want to work on our activities of daily living, tying shoes and so forth, those fine motor skills. And they'll say, that's great, we understand that, we agree. We would have you see someone in the hospital or community setting because that's not deemed educationally relevant. Whereas in that same example, handwriting would be educationally relevant, so or typing, learning typing skills. So thinking about those things is really important as you ask the school for that type of support. I do have many cases where my patients will have OT both at school for those educational tasks, but also out in the community for more of those activities of daily living. And then each of those, I have this sense, kind of reinforces each other because they're getting practicing those skills. I do think it's important for all of us to be aware of our procedural safeguards for special education. Parents do have to consent. They can revoke that at any time. They have the right to disagree. I tell, in working with families, I say, listen, if you're in the room, if you're in the meeting, you don't like how it's going, they ask you to sign an agreement, you don't have to sign. And you can disagree and hold off, consult with your team or your providers, reconvene at another time. There are several things in place as procedural safeguards when pursuing these services. So that was the longest section here. I'm going to pivot now to our Section 504 of the Rehabilitation Act. This goes back to 1973, and this is a civil rights law that prohibits discrimination on the basis of disability. Many times for our students who don't qualify for special education, they might qualify under Section 504. I've even had students start in a 504 plan and over time decide they need a little bit more support under special education. So it's, these are different kinds of programs and different plans, and I'll tell you about that. So the purpose here is to accommodate a student so they are able to participate, like their non-disabled peers, so they can access this setting in a similar way. You'll hear leveling the playing field as a phrase that is stated a lot of times. So it's an accommodation. I'm going to spend more time talking about what that means and how that may differ from something in special education, such as a modification, and that will come up again some more. These can be, let's say learning is not the problem and our accommodations may have nothing to do with learning. It might have to do more with things like adaptive PE or adapting that school schedule that I mentioned early on. So this is for non-academic and curricular activities as well as academic. So this process is much more simple and straightforward, probably even briefer. So the parent requests that accommodation. We always say put that request in writing. Then there's a meeting with the school and the team to talk about it, and then a plan is developed. Same thing I said before, if a parent doesn't agree with that plan, you don't have to sign in agreement and can reconvene at a later time to work through that. So we've talked about a lot of different things here, and we're going to switch now to wrap up with ADA accommodation. So this is Americans with Disabilities Act, originally passed in the 90s and then amended not too long ago, and I guess it has been a while now, but in 2008. And so this extends coverage of Section 504 to employment settings as well as higher education and other areas. Like I said before, I am going to focus on higher education, college, universities, since this topic is about school support. Really important to note here, our students in college requesting accommodations have to meet the same standards as other students. And that relates to our kind of pre-admission, our SAT scores, our GPA, all of those things. But it also applies when they get to campus. They have to meet the same requirements of a course or program. What I always tell our students transitioning to college is your degree means the same thing as your colleague without a disability, right? So you still have to meet the requirements. But the difference is you might get an accommodation. And so going back to this point I alluded to earlier, it's the difference between modifying an assignment. Let's say there's a student in K through 12 who's at a second grade reading level, but they're in the 5th grade. Well, we need to modify their work so that they can read and understand the materials. Accommodations, the 504 or here in the college setting, are meant to say give them that extra time if it takes them a while to read or process information. Maybe handwriting is a factor, they need more time, but they're doing the same exact work as their peers and their colleagues without disabilities. So that's a really important point to know. These are some examples of academic accommodations. Many of these would pertain to the K through 12 setting and certainly the high school setting so that they can carry over to college. It is a completely different process, and in college they don't tend to use the term 504, but we'll talk about ADA accommodations. So a few final points. I want to say a few things to parents. Here, today you're educating yourself on the process just by being a part of this event and hearing this talk. It's important that you understand the rights of your child as a student, but also helping them learn, especially as they age, how to self-advocate, how to put into words what the challenges are and what their needs are. As we said earlier, always put requests for support when you're asking the school, always put that in writing, because there's a record and it triggers a clock that starts running, and the school only has so long to respond to the request. For our medical team members who may be listening in today, I would say partner with your team members who are knowledgeable about school services. I have mentioned we have a school liaison. I, in neuropsychology, have a background actually in school psychology, so this is an area we spend a lot of time talking about in our clinic. Also, we partner with schools. They are our community partners. We think about continuity of care that extends into the classroom, into the community. So we want to partner with our schools and teachers to help our patients and our students. Recommend eligibility categories. I mentioned other health impairment, but there may be others that apply as well. Provide any assessment findings from the clinic or from testing. The reason I highlight this is because if I do an assessment and we provide that to the school, it may save them from doing that whole evaluation that I mentioned. They may still decide to do the evaluation, but it could also save that resource and that effort and time. Providing detailed information about the child. There's a lot of school forms that have to be signed by a physician, so being sure to be detailed in those so schools know exactly what is needed. Schools don't know typically what AFM is. I know that this audience knows that better than anyone. And then we always say in healthcare, just avoid the use of acronyms only, especially when communicating outside the hospital. And I'm going to speak to our students if we have any in the audience. You are your own self-advocate. This is going to change a lot as you age, and especially as you go from high school to college. Parents are not as involved, but you've got this, you can do this, and you're going to have a lot of practice leading up to it. Here is a depiction of the point I made. It's almost as if a light switch flips. Overnight, our students are really in the driver's seat, so we can see students are in charge when it comes time to college for making sure they get the accommodations they need. Last resources here, I just want to share. I would say identify your state education agency. They are the ones responsible for executing that federal law in your state. That's why there are some differences state to state. If you have problems with a special education situation, you can call that state education agency. If you have problems as it pertains to 504 services, that goes through the Office of Civil Rights, and that would be the place if you had to file a complaint or problem solve what you should do. Talk to your medical teams. People like me and other team members are really knowledgeable, especially those in the pediatric setting. We need to know the school system and how all of this works. I've given a few other things. One is specific to Texas, but gives a lot of great information on that federal law that really applies, federally and throughout the U.S. And then some other advocacy groups. This is that school guide, tiny print here. I will make sure this is shared with participants. This was developed again by Linda McCowan at Children's, and our clinic worked on this together. I'd like to acknowledge my team members for everything that they do. We've been at this now for almost 11 years. As the previous presenter said, we've learned so much from all of you, from all of our patients in this time. I really want to acknowledge my two dogs photographed here for not barking during this presentation. It's kind of a miracle. And now I'm going to transition us to have everyone join us in the session area where we're going to have a panel discussion and Q&A. So if you've thought of some questions throughout these talks, we welcome those in the next session. Thanks so much.